Um, anyway, okay. So you have alluded to your diagnosis story in quite a few of your videos. So I'm very excited to actually hear this story about you being diagnosed in the 4th grade after you started a riot in your classroom. So let's backtrack a little bit. So first, I mean, it couldn't have been out of nowhere. Like, what was happening? I feel like I don't get to interview a lot of women who were diagnosed in childhood. I feel like you guys are
Yeah.
kind of you're unicorns for and so obviously your parents were kind of pioneers, but like, what happened with this riot, and what were some of the signs that were going on in your life that your parents kind of looked into this diagnosis for you?
I mean, I don't know if they were pioneers. Like, had you met 4th grade me, you'd be like, oh, okay, something you got to do. I think it got bad enough where they were like, she's smart. She's definitely smart. She can figure out testing. She can do all of this stuff, but she is in everybody's business. Like, I'm always talking. I'm always getting in trouble for leaving my seat and sharpening my pencil when pencils were a thing, I guess. Sharpening my pencil 40 times a day and going on bathroom breaks and just like being found at different places in the school. And they're like, what are you doing? Like, I don't know. So, I mean, there were signs leading up to it, but yes, my riot story. So there was a substitute teacher that day. I got all the other kids to stand up on their desk, and we just like it was an organized protest in 4th grade. And like, for no other reason, I don't really remember all the details about it, but I mean, I remember just thinking it would be hysterical. And I remember seeing like, it was this young man substitute teacher. And I remember seeing his face and like his face dropping. And then I'm like, oh, that's probably not super nice for him. Like, that probably bummed him out. And like, I immediately felt really bad about it. And then I was like, why did I think this was a good idea? This is awful. And then, then like it got brought to my actual teacher's attention, and then they brought it up. And like, I think parent teacher conferences was like right around that time, and they brought it up in parent teacher conferences. And then, I to be honest with you, I went to the pediatrician, and then like my life just got much better. I was able to focus. I was able to pay attention in school. Like, I really enjoyed school, all of it. I enjoyed school before for the social element, but I actually liked doing the work. I would get involved in the projects. I would be like, it was really fun for me. My parents are well educated, but they were very concerned about the stigma of medication. So they were like, I recognize that this is a problem. So they wanted me to be on medication because they thought it would be helpful, but they didn't want me to be burdened, or what they assumed is burdened, with a diagnosis at that age. So they told me it was a vitamin. So all throughout 4th grade to high school, the end of high school, I was on the same milligram dosage of this vitamin. And like, I never skipped my vitamin, like every morning, like holidays, everything. I mean, I just was taking this vitamin every single day. So then I ended up doing pretty well throughout high school. And then I got into medical school after high school. So I was looking during high school. I was like, what's the fastest way to go to medical school? Because my mom's a physician. I knew I wanted to do exactly what my mom did. She's a pediatrician. And so I'm like, I just want to be a pediatrician like tomorrow. How do I do that? And so I ended up looking into these things and found some programs. And I was like, oh, okay, sweet. There are these programs that you can enter med school right out of high school. And it's all at the same time. Your undergrad, your grad, all of it's together. So the shortest time that they would have is a 6-year program. There were 2 programs. There was one in Kansas City. There was one in Philadelphia. I went to both. The Philadelphia one was too far away from my parents. So I started in Kansas City. And then as soon as I got there, it just sucked. I sucked. Like, I went from being like a pretty, like, without having to try exceptionally hard, I did okay in high school. But this, I mean, I felt like I had had a stroke. I could not function. I mean, I remember on my first neuro exam, I got a 68%, and I was the second lowest in the class. And I was like, okay, something is awry. My parents were like, are you taking your vitamin? I was like, no, obviously not. I don't even know how to do my laundry. I'm by myself for the first time. Like, what is this? And they're like, okay, well, turns out it's Ritalin. It's surprise. And so I'm like, okay, that I felt very betrayed. I felt really angry at that time because I felt like I just kind of eradicated everything that I knew because I felt like I was drugged into performing and that all of my achievements were really my own. That it was just like I took this medication to help me. And I was fully convinced. I'm like, there's no way I have ADHD. That's for boys. It's not like that's not a thing. Anyway, so I rebelled against the diagnosis. I went without medication for the first like year and a half of medical school. And I nearly got kicked out twice because it was so difficult. It was literally so difficult. I could not get my act together in even simple things. Like I wasn't waking up for classes. I wasn't like, I would try so hard and I would study for like 3 times as long as people. And I would barely pass the test. And I was like, what is this? Why is this so hard for me? Why can I, and what's hard is with a program of that pace, any program probably, is that it really depends on foundational knowledge. And I just wasn't building nothing was organized enough to go into my head. And so every day I was reinventing the wheel. And then, I was just like, I have to go home. Like, I can't be in this program anymore. I hate all of you. Like, I just don't want to be around anybody. And I just I hated seeing my teachers. I was so miserable. Like, and like, I went the other way. Like, instead of like buckling down, I was so discouraged. I'm like, if I can't make it through, and I know I'm going to get kicked out anyway, I'm just going to have fun. So then instead of studying, I would like go out with my friends, or I would do this. And like, I was like, I'm going to have a college experience. I'm going to do what I want to do. But then that further pushed me into this hole of like, well, who am I? Like, I used to be this really smart kid, and now what am I doing? So then I remember I came home and I told my parents, I'm like, I'm not going to do this. I cannot do this. And they were like, I think so I was supposed to be studying for a test, and they're like, we see the ADHD diagnosis, but you don't. So why don't you spend this time and you focus on ADHD and you see if this makes sense to you? Because I mean, if you don't figure this out, you're going to have to do something else, and you'll have to figure something else besides medicine, a path for you. So they were like, just sit and think about what you want to do. So look into ADHD, look into other career paths. And they were actually really, it sounds really judgmental and weird. It wasn't. It was in a like, we'll support you either way, but just look and see kind of if something tracks. And so I'm like looking into ADHD, and I was like, oh yeah, that's me. And so then I'm like, I want to do this on my own. And so, my parents were still very helpful for me, but I kind of had to limp through finding the right medication. And like the medication I had throughout high school just wasn't cutting it in terms of length of focus or anything. And I tried a couple which like blasted my appetite or messed up my sleep or made me so emotional. And so it took me a while, and I didn't actually get on the right medication till maybe like a year or 2 before medical school ended. And by that time, I was just kind of catching up and trying to course correct this whole time. So med school was a dumpster fire, but it cemented, by the end of it, it cemented kind of my passion and direction. And that's kind of why I ended up doing psychiatry and why I ended up specializing in ADHD.
Yeah.
That's a
right?
really long explanation. I'm so sorry.
No, it's great. Gosh, yeah. I mean, finding the right medication just feels so meta when you have ADHD, because it's so like all of your barriers come to the fore when you're trying to find the right medication, right? Like it's like, I have to understand what I'm even looking for with medication and when it's working, and I have to keep going back to the doctor and having this discussion and articulating what is even happening to me is so difficult, much less getting the doctor's appointments and then paying for the damn medication and like all of that stuff. Like, when you were figuring all that out, were you doing this with your mom because she's a pediatrician, or so you had that?
I was really lucky. I had my mom to kind of help me and do it. So it was remote. So she was in California, I was in Kansas City. So she, the thing is, like, my mom knows me pretty well. I mean, too well, probably. And like, she could even tell, like, from the cadence of my voice or how I was talking. And like, even on a phone, this was like I mean, this is probably dating me. This is before FaceTime. FaceTime wasn't a thing. Skype wasn't a thing. So like she's getting all of her data just from how my voice sounds. And she is like, I can tell that this medication is making you more irritable. I can tell that you are, that have you eaten today? Have you done this? So it was nice to have that third party to kind of bounce those questions off of, because then I knew like, okay, this medication is probably not for me, because it's so hard to have an accurate gauge of your own internal environment. It's just hard. Like you're trying to verbalize stuff that intrinsically you might not understand in and of itself, or like for years and years and years, you're like, I thought that was normal. So, I mean, it's just weird. So you're trying to explain all of this stuff. So having someone else that, sees you on a regular basis is exceptionally helpful, because it's kind of like, they can observe symptoms and changes better than you can sometimes.
Yeah. I've talked about this a lot with antidepressants, right? Because I feel like a lot of us who were diagnosed in adulthood were diagnosed with depression and anxiety.
Yeah.
And so I was on like a cocktail of SSRI, Wellbutrin, and always sort of was falling down that hole of upping the dose, right? Like I would go to my doctor and be like, I don't think this is working. I don't feel like I'm doing any better. And so then it was like, well, let's try a higher dose. And then I would get into that mindset of like, well, if it's not working, or no, if I'm this bad on the medication, imagine how bad I'll be off the medication, right? And so then you fall down that trap, which is sort of, is this even the right medication? I don't know. Let's try the upper dose. Like it just feels like you're constantly throwing darts at the wall.
And it's extra frustrating for antidepressants, because sometimes, and this is what I tell people, sometimes when they're like, I don't know if this is helping, they get off their medication for a couple of days and they're like, oh, I feel much worse, and it must be that I need this medication. No, you could make a normal person, you could put a normal, like, I don't want to say normal, but like someone who has absolutely no mood pathology, and you stick them on an antidepressant. If you pull them off of an antidepressant, they're going to have withdrawal. So it's not necessarily indicating that there is like this resurgence of pathology. It's saying that, your body, those chemical receptors are empty, and now you're having symptoms. So it's difficult, because you have this like feedback loop that's telling you like, I really need this. And maybe that's not the case. And especially it's not, for people that have been misdiagnosed, because a lot of women, they get misdiagnosed with mood and personality disorders because no one's looking for ADHD. It's hard, because I feel like half of what I do is I'm just cleaning up messes from other physicians where I'm like, this is dumb. Why were you on this? But I think I know what I'm looking for, or what I'm not necessarily looking for, but ADHD is on my radar. So when I'm having people who are describing, that a certain set of criteria, and they also have, I have the additional benefit of seeing that they failed numerous antidepressant trials. I'm like, okay, we're missing something. Either genetically you just hate antidepressants, or it's not depression.
Mm-hmm. Yeah, I know. Right. And then not only that, but then, ADHD kind of presents itself at some point as the solution, not the solution, but at least the answer, right? So you're like, oh my goodness, I feel so seen. I feel so understood by the TikTok videos, the memes, however it's coming at you, right? And you're sort of feeling like, oh my goodness, this could be the answer to everything. But then there's right. But then I also sort of struggle with that. I think a huge part of the diagnosis journey is also the self-doubt, right? So you're always like, well, maybe this isn't it. Maybe I'm just exaggerating. Did I really struggle? Because that's also the answer, right? Which is like, well, it's only ADHD if you really struggle. And I'm like, I don't know. How much did I struggle? How much am I struggling? Right. And I can get dressed in the morning, so I'm better off than some people, but like, so you have to question that. And then also there's this idea of like, well, you shouldn't, if you have ADHD, you should get professionally diagnosed for a lot of reasons. I think that's important, but like it could be something else. And then it's like, well, what is it? I've been told I have depression and anxiety. So maybe it's just that. But then on the same time, you're like, well, it can't, maybe the ADHD is causing the depression and anxiety. So I really feel like it comes back to the ADHD, but then you risk going to a medical professional who doesn't really know enough as much about ADHD as the freaking TikTok influencers do, right? Because so much of this understanding is through the shared lived experiences. And you've talked about this too, right? This sort of dichotomy between like you are the expert of yourself. You are seeing these videos, you're seeing these lived experiences, and they're relating to, you are relating to them on a deep, deep seated level. But at the same time, it's important to kind of talk to a professional. But oftentimes the professionals that are available to us don't know enough about ADHD or have a very different idea of what ADHD is. And then you're back at square one. And so it's sort of like, well, what do I do in this situation? Am I just grasping at straws? Is it ADHD? Right. Am I looking for an answer and I'm finding it in this like perfect acronym that's summing up every struggle I've ever had in my life? Or is this a misdiagnosis? And, that's like, I say that all the time where I'm like, maybe it's not ADHD. Maybe I'm just a feminist living in a misogynist society. And we're like, still have this collective post-Trump trauma that we're all living through. Right. I mean, I was a pandemic diagnosis. So like there's been a proliferation of diagnoses of ADHD since the pandemic. At least it feels like it. I don't know. I haven't really looked into the stats, right? So there has. So then I'm like, well, is this even ADHD, or are we just experiencing a collective trauma right now? And it's going to at some point settle down.
That part of it is also with this pandemic, it was just a huge functional and life change. Now, all of a sudden, we're forced to work remotely. We're having isolation. We're more on our social media and our phones, and we're learning and identifying symptoms that maybe have gone unnoticed. And now this perfect storm of changing your situation and now working from home and being isolated and, and knowing more has led you to this diagnosis. So so yes, definitely there is a part of just how utterly traumatic the past 18, 24 months have been. But I think a lot of it was, I don't necessarily think that it's misdiagnosis. I think it's stuff that has been, for women, especially who've gotten it, like have had to go through life masking so significantly for so long. This kind of probably was that, catalyst that it's like, okay, this isn't working right now. Especially like during that time where they had to teach your kids from home and do all of that stuff. Like how horrible.
Right.
Horrible.
Yeah. Oh, I know. Yeah. I mean, that was really, I've spoken to so many women who were diagnosed recently because it just felt like the house of cards got blown off the table.
Yes.
Yeah. And then, what was it? The misdiagnosis. I also sort of feel like at the end of the day, if you misdiagnose yourself with ADHD, I still think you're in a better place in terms of like starting to understand who you are and what you do. Instead of defaulting to I'm a failure, I am lazy, I am a terrible person, which I think a lot of us were doing for a myriad reasons, as women, as in a Western society. Like, I think there's lots of reasons why we might kind of feel terrible about ourselves if we can't do mundane domestic tasks, right? Or some of the reasons why I feel like women in particular are understanding how ADHD plays into some of the struggles that they've had as mothers and as wives and as, at work and all that stuff. So I think it's like, even if you're misdiagnosing yourself with ADHD and not, seeking a formal diagnosis, like there's not a lot of harm in that. I think the benefit so greatly outweighs the harm in thinking you might have ADHD. So maybe you should, go out for a run or, be kinder to yourself, or all of these things. I don't think a lot of people are like, I'm going to go out and get black market Ritalin.
You'd be surprised though. Well, I mean, so here's the deal. I'm kind of on the same page. Initially, when I was on TikTok and things like that, I really had issue with self-diagnosis. And then I thought about it more critically, and I'm like, a lot of people, they just simply don't have access to care. And this is their exposure. And they're resonating with something that they've seen. And they're like, this is an explanation for the symptoms I'm having. All right, cool. There's so much behavioral modification that you can do to help manage those symptoms better, use appropriate self-care, do all of those things a little bit more soundly and appropriately. Love that. here's my issue with self-diagnosis. My issue, I think what it's boiled down to is one, exactly what you touched on. Some people, they feel like, and it's not even like, we have this like this image of this like covert operation and like drug dealing in the park to get this like off market like black market Ritalin. No, like college campuses is just like, your roommate will be on Adderall or something, and then the other roommate will be like, oh, can I have some? I think I have ADHD. It's like that. It's like not, it's not something that is this elaborate, well thought out process. It can happen very easily, and accessibility to certain medications can be high, but which is weird because it seems like when people are diagnosed and really need it, it's difficult to access it. But like in certain situations, it's high. And the problem with self-diagnosis, and in those situations, and I'm talking almost not exclusively, but at college campuses is a big one, is that with taking a medication that you haven't been prescribed, the problem is that you run the risk of, you're putting a neurostimulant. I mean, if that's what you're taking, which is normally what people are taking, you might feel like, oh, this makes me feel better in the moment. Well, that you're getting a transient effect. It's not actually indicative, and it's not a diagnostic thing. Like this is ADHD, this is not. It might temporarily make things better, but it could increase heart rate. It could cause problems with thyroid. It could cause a whole slew of emotional problems as well. And then that coupled with alcohol is just like an absolute dumpster fire. So like there is, I don't really have issues with self-diagnosis if you're using it for behavioral modification. I think anytime you think about medication, even if it's really readily accessible to you, you have to do it through a physician. You have to, because otherwise it's too dangerous.
Yeah. And I guess you're right. I sort of feel like that goes without saying, that you shouldn't be taking somebody else's prescription medication, but maybe it doesn't go without saying when with the scenario you're talking about, which is like, I watch TikTok, I think I have ADHD, so this is ADHD medication, so why don't I just kind of take a few shortcuts and try my roommate's version of it, as opposed to actually all of the hurdles that we experience in this country going through the process, and then also like how expensive it is. You might want to just try it. Yes, so that exactly. I think diagnosis for the sake of medication is absolutely important, but I also I feel like we can't deny the fact that there are, so that we're almost at this impasse in terms of like lived experience versus what medical professionals actually understand about ADHD. Like it's almost like we're neck and neck in this horse race in terms of social media and how this is being described to people versus how it is in the DSM, and the lottery of terms of who you're going to get as a medical professional, and what they're going to understand about your symptoms, and how, if you're even going to be able to articulate it. Like that's the other thing. Like the advice I always give to women when they're seeking a diagnosis, I'm like, take a checklist. Do not go there unarmed, because the moment you get into that office, you're not going to know what to say. You're going to feel overwhelmed. You have 15 minutes. Like, so you need to go with like an absolute list, because you're not going to remember. That's ADHD. And if you do remember, then maybe it's not ADHD. But like, I feel like that same idea, there's just so many barriers to getting this diagnosis that I feel like, social media is filling a hole. Whether that's good or bad, I'm not sure. So when you first joined, because you joined TikTok a year ago, right?
I joined it in December
of 2020.
Like a million years ago.
Yeah.
Yeah.
And so when you joined it, were you like, there's misinformation and I want to set the record straight? Or were you just sort of like, I'm bored and this would be fun? Or was there an official reason when you joined? Or were you just kind of like, because there's a lot of doctors on TikTok.
I know. I didn't even know about that. But like for months, my sister had been like, you need to join TikTok. They have really good makeup tips. And I was like, no, no way. Like I spent most of 2020 making fun of TikTok. I was just like, it's for 12-year-olds. This isn't like a thing I should be on. But then the frequency of this, it just escalated, because we were doing telehealth. I would have patients hold their phone up to the screen and they're like, because this video says I sneeze multiple times in a row, I have ADHD. And I'm like, no, that's stupid. That's not a thing. And so like, I was just blown away. I mean, I'm not even kidding. Maybe like 3 or 4 times a week, I would see something where I'm like, how is that even on the internet? So then I was like, okay, well, there's not or like, this was my limited knowledge of it because I wasn't actually on TikTok and I didn't get shunted into ADHD TikTok yet. So I didn't think there were a lot of resources. So I started making videos on that and then, TikTok happened and I was just in it. And then all of a sudden it was my whole life. But yeah, so I don't know. It was like a 50-50 split of me wanting to provide good information and also me wanting to have good eyebrows. So that's how it happened. Yeah. So I that's, but since being on there, there's been a huge amount of wonderful information, both coming from providers where it's like very good clinically based information. There's some fabulous therapists, there's some fabulous psychiatrists on there that give good information. And then there's some good lived experience, which are really I love one of the first people I followed on TikTok. She's also on Instagram, is Your ADHD Mom. I don't know if you've seen her or talked to her.
I don't know. Maybe I probably follow her.
She I started following her in the very beginning, and she was talking about her on her thing. She calls herself an accidental ADHD advocate because she just recorded her entire experience from beginning to end of getting diagnosed. This is what I'm seeing. I'm thinking this is it. Okay, now I'm going to my doctor for the first time. And so it was just such a cool experience because you're going through all the pitfalls and the successes and all of that with her. And so I feel like that was such a vital and important thing to document and see. So I love things like that. I do have some beef with some people providing information where it's not coming from a lived experience, where they're trying to provide clinical data, because some of it is wrong. And some of it, the problem which I have with people that are giving clinical data that are not medical professionals is that I don't think they can appropriately monitor what's happening in their comments. Maybe no one can do that, but then you get a lot of comments that can't be ADHD because of this. And it's well, no. And so I feel like sometimes with misinformation that's put on there, it actually serves as a barrier to care. It deters people from getting appropriate care, which is sneaky.
Yeah, and I think it also kind of builds up a lot of stereotypes about what ADHD is and isn't, which can increase stigma around brushing people off, or or the other thing, which is using ADHD as an excuse versus using it as an explanation. So I'm always talking about that with my kids, right, where I'm like, ADHD is not an excuse to be an asshole. You still have to figure out how to do the thing. But it can give you an explanation as to what's happening in your brain and where what you need in terms of getting from A to Z. But I think that, I do see a lot of that stuff where I'm like, oh, using ADHD can be referred to quite flippantly sometimes and be like, oh yeah, that's my ADHD. And oftentimes I'm like, well, we do still have to take it seriously in terms of how, destructive it can be, or how, like you said, sometimes there, I'm losing my train of thought. Basically, I'm like, that your life is still hard, and
Your life is hard. Yeah.
right. And so if we start talking about ADHD, like it's this, adorable thing where you're like talking about squirrels all the time, then we're really just brushing over some of the like real issues and the misdiagnoses and the real like comorbidities that are out there.
And like not just squirrel, but like what I feel like is especially kind of traumatic for me is like when I was seeing this huge surge of like ADHD is my superpower. And I'm like, I want to punch you in the face. Like, I don't like, do you like I get that the theory is that they're trying to put a positive side and like make you see that maybe there are some things about ADHD that can be worked into a positive, but like overwhelmingly, if you were to ask me any day of the week, would you rather have ADHD or not? I'd be like, no, I don't want to have it. I would way rather not have it. So I feel like putting things into like, this is my superpower. If you could just harness your hyper focus, I mean, it makes you feel like ADHD has this volitional component where you can just be like, oh, if I just will myself into focusing at this certain time, I can do anything I want. And it's like, okay, that's not how the brain works.
Yeah.
Like, okay, if it's this perfect storm of you being absolutely engaged in something, then maybe you can kind of get it together in that time. And maybe you can behaviorally modify to make it easier, but it's not something that you can kind of turn on and off. And it's not like if something becomes a superpower, it is by accident or like
right, yeah.
by chance or like something like that. It's just like a blessed occurrence. So I feel like utilizing terms like superpower and I hate that. I mean, it drives me absolutely bonkers. I hate it. I hate
No,
it.
I'm the same. And, and I feel like with coaching, right? Like I feel like coaching can be really, really predatory in terms of ADHD coaching. Cause it's like, we're going to do this and we're going to, if you pay me, I'm going to help you, transform your life overnight.
Oh
and
gosh,
you're like, you are taking advantage of the impulse to want to kind of jump on these trains. Right. And I just feel like of all people, you should understand how problematic that kind of like, tapping into that need for that, impatience and impulsivity can be, I feel like it's just gross a lot of the time.
It's so disgusting. It's so disgusting. And like, that's another thing. Like, that's another thing that I've that has opened my eyes. I didn't actually know this, like, maybe I'm a moron and I should have known this, but like, I didn't actually know that ADHD coaching was a thing outside of like therapy. Like I thought if people were talking about like I have this life coach or something like that, I was like, oh, okay. But then when I started going on TikTok and Instagram and people started asking me questions about like, hey, I just signed up for a course with this life coach. And then you click on them and it's like this shoddily done website. And it's like, these people are talking about this is guaranteed to fix your brain. And
oh
I was
my
like,
God. I know, right?
I'm going to shut you down. Like, how dare you? Like, how could you take this extremely vulnerable population and how can you make these promises when you're not? What kills me, what absolutely kills me is that there's no governing body for this. You don't pass any sort of like, I mean, the ones that I'm talking about, that maybe there are some kind of certifications or things like that. But in general, you could call yourself an ADHD coach just because you have ADHD. That's what I do. I'm turning this into a positive. I'm going to teach people based on what I've experienced. But everybody's brain is different. It's not coming from any sort of neurobiological basis or deeper understanding of how the brain works. And I think that's how you get better understanding of yourself, and because you start tying together things and you start seeing correlates. And so it just scares me when people are trying to push, maybe this is something that works for them, maybe it's not, maybe they're just saying that because it's convenient and they feel like ADHD is lucrative, and so they're taking these people to just waste their time and money and potentially harm them more. You're right, it's gross.
Yeah. and sort of ruin them for this idea of like, I think we have a tendency to chase things and lose a lot of money. I think it's an ADHD tax I've certainly experienced, right? Which is like feeling like I'm going to get the quick fix, feeling like this is the next answer, funneling money into things, and then feeling like it's a waste. And then you get trigger shy, is that even a word? You're just like, so. Right, where it's like I'm worried about doing anything constructive because it's a sense of like, oh, I have a tendency to like just jump on things and waste money, and so it's the Wild West out there. But now, just for listeners and for my sake as well, like, what would be the difference between seeking a psychiatrist versus a licensed therapist if you have ADHD?
Psychiatrists can prescribe medication. So that is the biggest difference between them. Psychiatrists have gone through medical school. So I think that's actually really important. So in terms of going through medical school, because they can at the time of your assessment, they can also do a more comprehensive look at everything going on. They can look at your other medications, they can look at medical disorders, and they can kind of feel like, okay, maybe this is actually a thyroid problem. Maybe this is actually autoimmune. Maybe this is, and so they can kind of tease out, is this from an underlying cause? They've also, through their psychiatric residency, they have gone through, depending on the residency they do, mine was very psychotherapy heavy. So we went through all the therapy modalities. So we can also kind of talk about and at least direct you. Some psychiatrists do their own therapy. Some people are just like, they're too busy with it, with their other medication-based patients that they have to refer out. But they can identify if it's a psychological problem that's kind of lending to this ADHD picture, and then they can diagnose and prescribe medications. So that's kind of the biggest difference. But I mean, in terms of, therapists are fabulous in terms of ADHD diagnosis, because I think, to be totally honest with you, I think that they spend more time and can provide better skill sets. Because with the psychiatrist, you're going in there and like, you have your initial evaluation and then you have follow-up appointments afterwards, which are shorter. So I like going to a psychiatrist for initial evaluation and for medication stuff. But I'm just biased. I think therapy is awesome. Everybody in the universe should have a therapist. But I feel like it is so wonderful to be able to have that someone else who can get their hands on your brain and help optimize your life appropriately. That's so helpful, because like for me, even when I was going through residency, I didn't recognize any patterns because every day was different. And it's when I started working through those therapeutic modalities, I was like, okay, okay, this needs to change. And so they can help you build habits. They can help. So I think a combination of medication, if it's appropriate, and for a lot of people it's not, but a psychiatrist at least would be able to tell you. I would say at least 30% of people who come in, I don't start on medication, because I'm like, you don't, like right now, you could probably get adequate results if you did therapy, and try that first, because I don't want you to do a medication without building those good skill sets first.
Yeah, pills don't build skills, right? Am I right?
You are correct. You're very correct.
So now I'm curious, I don't know much, or I certainly haven't talked much about this on the podcast, with transmagnetic stimulation. And I know that's something that you work on with patients. Can you tell me a little bit more about what it is and kind of how it works in relation to ADHD?
So TMS is actually not something that's FDA approved for ADHD. TMS is something that is a alternative method for right now treatment-resistant depression. There's more indications being added in terms of like anxiety and OCD, and even some cases bipolar, depending on the machine, because there are different machines you can get. But basically what it's doing is, instead of putting a pill in your mouth and kind of hoping and praying it ends up in the right place, this is, you're mapping out the brain, you're figuring out where you need to stimulate. Then you're stimulating it with a magnetic impulse, with a repetitive, it's kind of like, have you ever been in an MRI?
No, I've never had one, but
okay, well, they're annoying. Yeah. I mean, this isn't actually, you're not like in an enclosed thing, but with an MRI, you get tapping like this.
Mm-hmm.
So it's kind of like that. You're getting this repetitive tapping, but what that's doing is it's formulating and building a good, healthy pathway. And what a lot of people see is with treatment-resistant depression and anxiety that often comes as a comorbidity, what happens is that your energy improves, then the depression abates, and then the anxiety gets better. So what I've seen is that for people who have ADHD and also have these comorbidities, sometimes they can never truly get on top of their ADHD symptoms because they're riding this fine line of like, okay, well, I'm trying to treat my ADHD, but if I start this medication, my anxiety goes way up. So then now I need to crank up my anxiety medication, but now I can't focus anymore. And it's just like, it feels overwhelming to try and treat two variables. And a lot of people are like, I am tired of medication. I can't do this back and forth. I'm walking a tightrope, and depending on how my life looks at the moment, I'm out of whack. It's miserable. And so I like TMS because one, it's not a medication. And I get it. I'm a psychiatrist and I'm supposed to push pills. Like, okay, fine, whatever. But like, I don't like medication. I mean, I see that there's a medical use for it at times, but like ideally, if we could be in a spot where we can behaviorally modify or be on the least amount of medication for the least amount of time possible, that's always where we want to be. So I like TMS because you're not using a medication, and it's one of our greatest chances of reducing medication use. And then if you can adequately address the depression and anxiety, so it's not really a variable, it's like you have this fresh new lease on how to treat your ADHD. And it's like your medications are working for the first time. So I bring up at TMS, one, because I love it. I think it's really helpful, but two, because I think it's one of those things that, part of the journey with ADHD that can be so frustrating is you don't really know what variable is being impacted. And so you're like, I don't really get why this medication is not working. Is it that it's just not working because genetically I can't metabolize it, or is there something else coming in the way? So for people that have both, and especially people who have struggled with trying so many antidepressants and they just, they need something else, this is great.
Mm-hmm. Yeah, I've talked about that a lot, which is like, I'm not by any stretch of the imagination anti-medication, but I also kind of feel like sometimes, like you said, medication brings with it so many questions, and it can be really just overwhelming to think about like what is working, what isn't working, who am I not, that sometimes it's just quieter to go back to your baseline and to kind of get off of it all and just be like, who am I without all of this, and then start from scratch again and again, and because I feel like I can get so worked up in the like, is this placebo? Is this working? Is this not? What am I, am I? And then you start to fall down the rabbit hole of like, well, what am I combining it with? And that is an endless question, right? This idea of like, well, all of the different environmental issues that might be coming into play with the medication. And it's just when your brain is on hyperdrive anyway, like sometimes the addition of medication can do more harm than good. And so, yeah, I think it's really fascinating to find some of those other methodologies in terms of, coming at this understanding, just like we were saying with therapy, like so much of the benefit of therapy is just parsing all of this stuff, just the like verbal processing and being like, okay, what is happening? What is going on? And just taking that chance to have a guided conversation about who you are and what's working and what isn't. Yeah. So now you work with a lot of kids too, right?
So that kind of
6 and up. And so that was sort of your desire to be a pediatrician comes through with working with children. Your face just like lit up when I said you work with children. That's always a nice sign.
I know. I love working with kids. And now, my practice has gotten out of control. Just having kids of my own. It's just like, it's difficult because, I only work when I have childcare available to me. But so now I've kind of limited my practice to like seeing adults of all kinds, but the kids that I see, I'm only seeing ADHD kiddos. I mean, my existing patients, but like my new patients are just ADHD, and it is like the most awesome and rewarding work ever. It's like so easy and fun. And like you get to, and now it's all telehealth and you get to see them in their own environments. And they're like, want to see my room? Yes, hell yes, I do. And so like you're seeing their pets and you're seeing like, it's just so fun. It's so fun. It's a good job to have right now.
Yeah, I have a 10-year-old and a 14-year-old. And so the conversation since my diagnosis, obviously it's been, we've had a lot of conversations in our house about like whether to get them diagnosed and what even, what is going on with them and how do we talk about ADHD, because I talk about it like with such positivity, like I'm just like, it was this revelation to me, and so I think it's so important to talk about it in this positive way. But my husband also has a lot of like, he's very nervous about getting them diagnosed because he also feels like, they're going to they're going to get labeled and there's going to be the stigma and they're going to get treated differently, or they may feel like, they might limit themselves. They might feel like I can't go to medical school if I have ADHD, or I can't, like all I do is talk about how hard motherhood was with with undiagnosed ADHD. And then there's a part of it, there's part of me that's like, oh, maybe I should stop talking about how hard it is, because maybe there's a 20-year-old out there that who's going to say I shouldn't have kids because I have ADHD. And I'm like, no. Undiagnosed ADHD, totally different from diagnosed ADHD. But I just feel like it's so like, I love the video. Every time you have videos about like talking to children or sort of like talking to, parents about like how to address and treat ADHD with their kids and how, to give it that positive spin and be like, you have this amazing brain. And I just think that's so important to really kind of change the narrative at such a young age about what this is, because right now the only kids who are getting diagnosed are the kids who are being disruptive, and their teachers are like, oh, Jimmy, I can't take it anymore, you need to put him on medication. And it's like, we're creating this generation after generation of kids who are like, who are, associate ADHD with being a bad kid, right? And or not talking about it at all, like the dystopian give your kid a vitamin tactic.
Yes.
Your parents took it. Does sound like The Giver or something,
I know.
one of those dystopian novels, like just take your pill, everybody.
Oh, it's very real.
But I think there's just so many questions as a parent where you want to do the right thing and you want to make sure that you're not screwing them up, right, by how you address their brain. So I so appreciate all of the kind of the way that you're digging in and diving into this morass and really helping people understand one video at a time.
Katie, I love your vocabulary. A bit I haven't heard that word in so long. Yeah, thank you. I the thing about, so actually this morning I put a little, I don't know if it uploaded, my thing was being weird this morning, but on Instagram, I partnered with understood.org. I don't know if you've seen their website, but like, it's a good thing to mention just because like, I try to bring to light as many like resources as possible. This is just like a free, for people that are trying to navigate those waters of getting a kid through school, which is hard. And if you're seeing stuff at home, these are resources where you can, like, how to do a parent-teacher conference, how to bring up ADHD within these kind of things. What if you're concerned about this, how do you talk to your parents, your doctor, your things like this? How do you address a learning disability? Like stuff like that, which I feel like, one, wonderful for kind of awareness, but two, from the logistical side of things, I think a lot of people have difficulty, like, how do I even approach this? Who do I talk to? How do I get this information across if I have these concerns as a parent? And so I think it's really helpful that now this is just people are making it part of their agenda. You just need to know where to look. Mm-hmm. I've been really impressed by them. I thought they were fabulous. And I love that it's free. You just click on it and they're like infographics. It's just very ADHD friendly.
Yeah, right. And and I think that's something that another thing we have a conversation about a lot on this, which is that like, trying to do things on your own and trying to navigate things on your own and trying to just be like, okay, I've got this new information. What am I going to do with it? And totally. Just getting so, going from 0 to 100 and getting so overwhelmed by the wealth of information that's out there and not even knowing where to start and like who to go to. And so, it's like I said, it's like, I feel like it's very meta when you get these diagnoses. It's just like, oh my God, I don't even know where to begin. It's so overwhelmed.
It's overwhelming. It can totally be overwhelming for sure.
So a question I ask my guests all the time is, if you could rename ADHD to something else, what would you name it? And I know that you've called it in the past always doing 100 distractions, which if that's your answer, I'm here for it because it's great. But
I forgot I did that.
have you thought about
Yeah.
calling it
So
something else?
if I were to, I have two. I mean, so I don't like the name. And I think if you take a poll, 100 out of 100 people aren't gonna like the name of ADHD, but they all have different reasons. I don't necessarily like the name of ADHD because I don't think it's an attention deficit. I think it's a regulation problem. So that's part of the issue. I don't like that hyperactivity is in there when that's just one subtype. So then I'm like, okay, why do we even need that in there? And then I would want them to include emotional stuff in there, which is right now not part of the diagnostic criteria, but it should be. I mean, it really should be. I think like almost 100% of people with ADHD deal with emotional regulation issues, just like from a neurobiological perspective, it absolutely makes sense with that chemical firing. But two, also, if you are just, beat down by society for years and years, you're gonna have problems.
Right.
So, I mean, I think what I would call it, what would I call it? I would call it attention and emotional regulation disorder. And I think the disorder part, I know people will have beef with this, but I actually think the disorder part needs to stay in there, because I think if you called it a dysfunction, or if you called it, I don't know, an issue, or you did something, I think disorder needs to stay, because disorder indicates that there is a clinical severity that needs to be taken seriously, like a bipolar, like in depression, that it's something that isn't just like this thing that you see in passing, that it needs to be regulated and treated with the same kind of clinical meticulousness that a mood disorder would have.
Right.
So, and then I think with getting accommodations and things like that, that word disorder is very pivotal, which I think a lot of people get like hung up on as like, I don't want to call it a disorder. Okay, fine. You don't call it a disorder, but I think it needs that in its name.
Yeah, no, I agree. I go back and forth because I feel like, yes, it needs to be taken seriously. And I feel like that there is some way in which the medicalization of it has to exist, but I also feel like there's a slippery slope when you get into, I'll take this out if I'm wrong. I think it's Doc Gaiman, but who was the one who was always talking about curing your ADHD, right? And so I think you get into
the scans,
right? But there's like that idea of like, if it's a disorder, then you're going to take this pill, you're going to cure it, and then it starts to get into the same category as diabetes, or some other medical diagnoses where you're like, this isn't actually what's happening. Like the disorder is coming from the fact that you haven't had the accommodations and the environmental whatever care that you needed in your life based on this neurodiversity. And so again, like I feel like there's ways in which disorder can hinder how it's treated or how it's even looked at in society, right? Like I always talk about when I came out and said I was diagnosed with ADHD, the vast majority of people were like, I'm so sorry. And I was like, no, that's actually, it's the greatest thing that's ever happened to me. But then it was like that slow realization of how, oh, you actually, yeah, ADHD, you have no idea what I'm talking about when I talk about ADHD. So I'm just going to stop talking about it with you.
That's fair. I mean, and I think disorder, it's not necessarily coming from just environmental factors, I think, or like medication stuff. It's not indicative, like if you take a medication, it's going to fix it. I think that's a very limited scope of how to look at this. I think disorder is coming from, you were born with this. This is how your brain is wired. And it is a difference from neurotypical wiring, and that predisposes you to all of these different things. So I don't think when I have people that are, I think that's what makes it a disorder, that it came from the very beginning and basis kind of form of like your genetic data and code. So and how dysfunctional it makes your life, obviously, but I don't know a lot of people with ADHD that it without significant modifications, that it's not impairing their life in some degree, you
Right.
know?
Yeah.
Like where they're just rolling around and they're like, I have it and it's fine. And it's like, okay, well then you don't really have it. Like,
Right. Exactly.
It's
Or
impacting
that idea
you.
of like, well, if we were all just cavemen and, some of us would be hunter gatherers and some of us would be farmers and then nobody would be suffering. And I'd be like, I don't know. I still think you'd probably have RSD if you were caveman. Just saying.
Yeah. You're bummed out. I want to be a farmer. Yeah.
I know. Well, I feel like I haven't stopped loving talking about it. And so I'm always so grateful to be able to have these conversations. And like I said, I'm grateful to you and what you are doing out there on the internet and trying to
Thank you.
break down some of that misinformation that's out there and put a real face to what this is. And so I'm so enjoy your content. So thank you.
Oh, thank you.
I know,
appreciate it.
I'm sure with followers comes all of the annoying headaches of the comment section and everything.
No, I mean, a little bit on like some of my like TikTok sometimes maybe, but even then it's been like overwhelmingly positive, which has been great because I can't handle negative comments. Like I'll think about it for weeks.
Yeah.
Like I don't deal with it well, but I think that it's like, even when there are things that are questionable, I think other people step in and they use that as a forum to gently educate, which I think is important. Like leaving those comments up there, because I think that there is some value in seeing like, this can be course corrected, and then judging on how the other person interprets it, because you do have to, in order to kind of maintain the integrity of the page, you do have to police those kind of comments a little bit better. Like if you're going to put something weird and racist or sexual on the page, it's going. But when there's misinformation about ADHD and stuff, sometimes I leave that up there because I think it's important to look at both sides of the issue and show people that this is still something that exists, and this is kind of the data to counteract this viewpoint.
Mm-hmm. Right. Yeah. This is what we're up against.
Mm-hmm. Yep.
Awesome. Well, thank you so much for your time. It was so lovely to chat with you, and really appreciate this.
So. All right, Katie. I'll see you on social media.
Yeah, right. All right. I'll see you out there. Take care.
Bye.
Bye.